morning and welcome to San Diego Living. I'm Greg Phillips. Well, if you snore, there's a good chance you may have sleep apnea. It's a condition that has some pretty serious health consequences. Dr. Ted Mazer with Alvarado Hospital joining us once again this morning. Welcome back. Thanks for being with us.
My pleasure as always.
All right, so first of all, explain what sleep apnea is and why it can be so dangerous to your health.
Well, sleep apnea is an obstruction of your breathing. We're talking here about obstructive sleep apnea, where you essentially choke. You stop breathing because your throat collapses, tongue falls back, and it has serious health consequences. It literally shortens life if it goes untreated. Your chance of a heart attack, of death during sleep go up, memory problems ensue. There's problems with virtually every aspect of day-to-day life.
Talk about the symptoms, if someone may have it.
The most common symptom that the patient experiences is poor restful sleep. So they wake up in the morning feeling like they really haven't slept, and daytime somnolence. Throughout the day they just feel tired, and in fact they might pick up a newspaper or sit and watch the television and just nod off, even though they think they've gotten a good night's sleep before. The other symptoms are snoring, usually observed not by the patient who's sleeping, but rather by a partner, who might also see that the patient is not just snoring, but they are holding their breath, they're gasping, they're awakening suddenly and then going back to sleep with a sort of a crescendo snoring pattern. Starts soft, goes loud, then stops during the breath hold. Those are real positive signs for sleep apnea.
Is that kind of when you say hold your breath, is it when they kind of have almost like a bubble in their mouth and then they just kind of let it out?
Not so much a bubble, but sort of they breathe in, stop breathing, and then they might do an opening gasp. They've been short of breath. They now open their throat by partially awakening and take that big gasping breath back in.
Does it affect more adults than children?
It can affect both. It's more of an adult problem. The pathology or the anatomy is different. In children, it's mostly related to things like large tonsils and adenoids. In adults, it's more complicated. There's a very big link to weight, but weight's not the only factor. There's anatomy of the jaw and the tongue that contribute, or even the nose.
Now, at Alvarado, you guys treat both snoring and sleep apnea. Is snoring ever normal, and how can it be treated?
I think almost everybody snores to some degree. Snoring is a normal thing. You get congested at night, you might have a head cold. That's okay. It's the loud snoring that's disruptive to a partner or even the person themselves. And then if they're having these breath holds, if they're having daytime somnolence, that's a good time to check out to see whether there's more than just snoring. The treatments vary and the impact on your life varies.
Now, a person's weight, as we see on the screen, it may have an impact as well, may have a lot to do with snoring and apnea. Talk about that.
Weight does a couple of things. It pushes up on the diaphragm when you're laying down, so you have to breathe with more force. It makes it harder to take a deep breath. And fat also deposits around the throat, which can create more narrowing and floppiness of tissue, sort of like sucking through a paper straw trying to drink a milkshake. That's what ensues. So weight is a big...
That's always tough.
Well, it's tough, but it's worth the effort. Definitely, though, in many people, weight is a factor. And in many cases, if you can get the weight off, you may reduce the snoring. You're not going to eliminate it. And you may reduce the apnea to the point where it's no longer a significant health threat, or treatment is easier. Treatment for apnea is usually dealing with machines that help keep the airway open, something called CPAP, or surgical procedures if people can't tolerate CPAP or it fails. Treatment for snoring is not that aggressive. Treatment for snoring usually involves palatal procedures. We use implants in the office. Some people use lasers in the office to change the shape of the palate, the vibratory tissue.
Now, what's this that you brought today? This is a tool that you guys use for snoring, to treat snoring?
This is one of the ways of treating snoring in the office setting. This is something called a palatal implant or a pillar implant. They're quite small, about the diameter of a dime. And 3 of these are placed in the palate under local anesthesia using a very large needle system like this, where we can insert it, one in the center, one on either side of that. Very easily done, pretty high success rate. Not elimination of snoring, that's an unrealistic expectation, but significant reduction.
Right.
This is FDA approved. It's FDA approved for mild apnea. When we get into the more severe apneas, you need to be a bit more aggressive.
And I'm sure the person that's snoring is very happy that it's that it's relieved, but the partner,
the partner is the big beneficiary. That's correct.
They can now sleep in the same room.
But in the cases of apnea, it's the guy with the apnea has got the bigger problem.
Right. And we see, Alvarado's number and website on the screen, 1-800-ALVARADO, and then alvaradohospital.com. Just really quickly, how do you determine if someone should get screened?
Very important. We listen for the symptoms, we look at the anatomy, but the most important thing, particularly for adults, is to get a good sleep study done if it sounds like apnea. So you don't just treat the snoring and mask the problem, you learn right then and there whether this is a significant health risk. And your doctor can order a sleep study for you.
Perfect. Dr. Ted Mazer. Maser, Alvarado Hospital. Great information as always.
Thanks, Rick.
And of course, for more information, go to our website, san diego6.com.